And this week, a major change in California's public health strategy, a plan to reopen sports stadiums, concerts, amusement parks, all prompted by a plan to get more vaccines to underserved communities. Let's start there. That new plan provides 40% of doses for California's poorest neighborhoods, meaning about 400 zip codes where 8 million people live. When those folks are vaccinated in greater numbers, it will make it easier to reopen businesses like indoor restaurants, movie theaters, and gyms. With us now, one of the key architects of that strategy, Dr. Mark Ghaly, is Governor Newsom's Secretary of Health and Human Services. His background is in public health and as a pediatrician. He's also the father of 4 kids. Dr. Ghaly, welcome to The Issue Is for the very first time. Great to have you.
Great. Thanks for having me, Alex.
All right, so let's start with the new vaccine strategy. This is a big deal for the state. How exactly is this going to work, and why now? Why is this so needed now?
Look, the communities that have burdened the greatest proportion of COVID-19 hospitalizations and deaths are those in these zip codes that we're targeting. So making sure that we more effectively get vaccine into the arms of those who live in these communities is a key strategy. And it's not just to protect those communities, but we know that transmission in certain parts of the state, those communities in particular, we talk about them as the lower quartile healthy places index communities, largely Central Valley, a lot in Southern California, LA region. When we can control transmission in communities and areas like those, we know that the whole state is going to be better off. So focusing the vaccine effort very, very much in those communities is a key strategy to get through this altogether. And I'll just remind you one last fact. We're seeing it in the data. We've said the data is going to guide us. What we're seeing now is this roughly 25% of our eligible Californians in the focus zip codes have only received 17% of the vaccine. Those in the more affluent areas of the state, over 30% of the vaccine. That's an inequity that can't be tolerated and that we're working hard to fix.
Let's talk now about the other big news of the week, a plan to reopen stadiums and concert venues outdoors. This is all outdoors, and this all begins April 1st. Let's put some of the information up on the screen about some of the numbers here. Stadium events can reopen at 20% capacity if the county's in the red tier, 33% capacity in the orange tier, 67% capacity in the yellow tier. This is exciting for a lot of folks, but walk us through this. What is this experience going to be like when you go to a sporting event? Because it's not going to be like what we saw before.
Yeah, I see this as an opportunity for us to basically wrap a bubble around a group of fans from the same household that go and get an outdoor experience of something that so many people have missed. They'll sit in seats pretty far away from others. They'll be asked to keep their mask on. They'll be helped in and out of the stadium. Concessions will be very different than normal. Not get out of your seat whenever you want to go up to the concourse and buy, garlic fries or a soft drink. There'll be a lot of controls on how fans come in and out. And I think still many people will get the joy of something they've missed for quite some time.
And, of course, get to go cheer on the World Series champion Dodgers in person. Another big announcement concerns outdoor theme parks. Starting April 1st, they can reopen. Here's some of the numbers there. 15% capacity in the red tier, 25% capacity in the orange tier, 35% capacity in the yellow tier. They're limited to California residents only buying online tickets. And this experience also going to be very different than it was a year ago.
Yeah, absolutely. You can see slightly lower occupancy capacity limits than the ballparks. This is because we know it's a little harder to keep people in a fixed seat or a single spot throughout the entire experience, but still focused on small groups, moving through the park, having short experiences on rides, keeping almost everything outdoors. Even in the red tier, some of the indoor dining experiences are going to be closed. So really this distance between people and still focusing on outdoors and keeping your mask on. And through that, what we've seen and the science tells us is that can be done safely.
There are folks that are watching this, though, that are going to say, look, Disney World has been open for a long time. Disney parks have been open all around the world except for in California. The Dodgers played in the World Series in Texas. There were fans in the stands then. Thinking back, do you think maybe we waited too long on this one?
I don't think so. We saw the winter surge was really, really hard on California. We saw hospitals full, and anything that might have added to that or made it a little worse, I think, cost lives. Our focus has always been on saving lives. I think that we're getting to the place where now the evidence that things can be done safer outdoors, the advent of vaccines, 3 high-quality vaccines that are getting out into the communities, and really these downward trends in the numbers put us in a place where we can begin to do this.
There's some Laker fans watching this, some Warrior fans watching this right now. They want to go back inside to watch a basketball game or other indoor events. What's the timetable like for that?
We're hard at work already. Over the next few weeks, we expect to be able to share that with Californians and anticipate when activities like that will come. But again, higher risk, still more concerning. There will be some delay compared to the April 1st for these outdoor activities that we talked about today.
Another big story of the week is what happened with schools. The governor at the end of the week signing a $6.6 billion plan to try to incentivize school districts to reopen. You're one of the top medical experts in the entire state. What do you say to parents? What do you say to teachers? Is it safe right now to go back into in-person school?
The overwhelming evidence shows with the protections that California not only has put in place, but insists on being in place, that we won't let schools operate without them, that schools can be operated in a very safe way. And I would say not only can they open, but they should open.
But you know well that there are teachers unions up and down the state that say we will not go back unless all of our teachers get their second dose of vaccine. Timetable wise, that could be a month and a half out. What do you say to them?
Well, I mean, we're working to make sure that they have all of the questions they've answered about what the vaccine does and doesn't do, why there's a chance to come back to in-person education in a safe, low-risk way with the current mitigating strategies even before that second dose of the vaccine is given. And we believe we're going to make some inroads. It's not going to be perfect, but little by little, and we've seen it throughout this pandemic, the more we show that things can be done safer and lower risk, the more likely people are going to do that.
A final sort of big picture question. You know that there's some Californians that are frustrated by the state's response. The governor now facing a recall largely because of this. You work with him closer than just about anybody. And I'm wondering if you can take us behind the scenes for a bit and just talk to us about any perhaps misconceptions you think that are out there about him, what he's like, and what he's done on this.
Well, I mean, first and foremost, he's a leader that is going to follow the science and the evidence and work hard to make sure that we implement that in a state of 40 million people in a thoughtful way. And I think we enter today with that in mind, as we have on almost every day of this pandemic response, and we'll keep carrying that forward.
And just lastly, I know there's been a lot of sort of tough news that you've had to deliver over the last year. It does seem like, although we got to keep wearing the masks and keep doing our part, things are significantly getting better.
I mean, they certainly are. The advent of vaccines, the improvement in our data and numbers, and just what we've learned, I think, allows us to do things differently. And I certainly appreciate all your viewers and all Californians' input and help to get us here.
Well, Dr. Mark Ghaly, thank you so much for taking out some time on a very, very busy time for you and the state leadership, and great to have you here on The Issue Is.
Yeah, thanks so much for having me.